If you're a veteran, thank you for your service, and you use the VA, and you are about to go into Medicare, this is a video that's going to instruct you on the two options that you have, and not to mention a nice little money saving option towards the end of the video. Let's get into this. Okay, so using the VA for your medical needs, which by the way, thank you for your service. I'm talking to you, veterans out there. This video is for those, again, who use the VA, but this is not for someone who also qualifies for TRICARE for life. So being retired from the military, this video is not for you. I will make one, I promise, for you specifically. So if you use the VA for, you go see the doctor, you probably go get your prescriptions filled, great benefit. And then you think, okay, well, what about Medicare? Do I need A? Do I need A and B? Do I need something called an Advantage plan? We're going to go into that. So your first option is going to be just enrolling in A. It is an option, but it's not one that I recommend. So in the future, if you decide to go use outside of the VA, so civilian doctors, if you will, you're not going to have that opportunity because you don't have Part B coverage. Hey, I thought I would pause the main video because I actually forgot something. Just remember, in this situation, if you are delaying Part B and only enrolling A and choosing to continue to go to the VA, if that is the option that you're going to take, if years down the road you decide, hey, I think I made a mistake and I need to enroll in Part B, you may have, and more than likely will have, a late enrollment penalty. Remember that there are penalties if you do not enroll in Part B in the allotted time frames, the enrollment periods, your initial enrollment period, your open enrollment period. For Medicare, Medicare gives you these time periods so you can get in when you're supposed to. If you do it outside, it's a penalty for the rest of your life. So beware. And as you can see in the upper left-hand corner, this is from the Social Security website, ssa.gov, easy to navigate. Let's continue. So when you enroll in A and B, yes, you will need to pay the Part B premium, which I'm making this video in 2024, so it's $174.70. You'll have your A, your hospital, your B, your medical, and you'll continue to use the VA. You have your drug plan built in the VA, which is a credible drug plan, which is why the next step, the next thing that I'm going to talk about is having A, B, and an Advantage plan, not a Medicare Advantage plan that has a prescription drug plan. Be careful, don't enroll in one of those because you would essentially be enrolling in subpar drug coverage. VA, again, VA insurance for your prescriptions is very good insurance, and it is, sorry, I should say very good drug plan because it's credible and 99% of the time it's going to give you a better price than the drug plans that are built into these MAPD plans, Medicare Advantage prescription drug plans. So I recommend this to all of my veterans. Some take it, some don't. Different strokes for different folks. So I recommend this because it's something the benefits in a VA an MA only plan have benefits that the VA don't offer and that Medicare doesn't cover. What are these benefits? Things like dental. Dental is a big thing. I find that as your age goes higher and higher, your dental plan becomes more important. So I get it. Dental is something that Medicare does not cover unless it's stemming from an accident. So I also find that it's a benefit that the VA does not offer as well. So enrolling yourself in an MA plan, you'll get an allowance of anywhere between $5 to about $1,500 a year to use on your teeth. Vision is also a hot topic. These MA plans, they'll have a allowance of $200 to use on frames, and it'll cover the exam, the eye exam that you would do annually. The next one that's A really hot topic for veterans is hearing aids. So there's different levels of hearing aids, and depending on how many years ears you need it for, it's usually something around a copay of anywhere between $399 per aid to 12 to 1300, just depending on the level of hearing aid that you need. The copay is significantly, I would say, a fraction of the cost of just self-paying for these hearing aids. My dad went to go to some place, and I mean, he was quoted a $5,000 hearing aid. So things like this, benefits like this could definitely help you if you enroll into one of these plans. The next thing is going to be over the counter credits. So these, it's literally in the name, it's over the counter. It's what you would go to CVS, Walgreens, maybe you go to the pharmacy section at Walmart and you go and buy your allergy pills, your band-aids, your first aid stuff. Anyways, all of that, you have a credit built into these MA only plans. They're anywhere between 30 to I'd say 50. So I've seen some plans $75 every quarter. So every 3 months, you get that loaded onto your card, or they give you a catalog to shop from. And you can say, yeah, I want to order this, 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 this. Kind of like a FSA, like a flex spending account, if you've ever had one. So you use that on over the counter qualified products. The last one, which I think is the coolest, was kind of zooming through the other benefits to get to this, is it's kind of like a nod to veterans to say thank you for your service. Every month we're going to give you, it's called a Part B reduction, a Part B give back. I think of it as like a reimbursement to your Part B. Every month you'll get a amount of anywhere to, I've seen $50 from to $125. Now, I said again, Part B in 2024 is 174.70. So this amount is something that will get loaded onto your Social Security check every month. Hey, and every little bit helps. So imagine instead of paying 174.70, less 125, and that's your Part B premium. So that is all in all a good reason for those four benefits: dental, vision, hearing, oops, five benefits, over the counter, and your Part B give back. Those benefits are loaded into an MA only plan. And these MA only plans, they're not going to cost you anything to get into them. So you have your VA that you go and do your normal thing that you're already doing. You enroll in A, you enroll in B with Medicare. So you're going to pay the 174.70 with Medicare. You enroll in a Medicare Advantage plan. All you're doing is creating these layers for your healthcare, which I think is a great idea. Here's one thing that you want to look out for. Some of these MA only plans and the different private companies, Cigna, Aetna, Humana, United Healthcare, BCBS, they're going to offer these plans that are specific to veterans, and some are also USAA endorsed. So just careful, because these do come in different shapes, meaning they do come in HMO, they do come in PPO. Just for the freedom of not being capped to a network, I'm going to recommend you go look into a PPO MA only plan if you're a veteran and you go to the VA. So that's it for this video. I hope this really helps. Do like, comment, and subscribe. If you got anything out of this, pass it along to your VA buddies, and comment if you've got any questions. So that's it for me. That's it for Alyssa. Have a great day.